here we are. This is Sex Love Psychedelics, and I'm your host, Dr. Kat, bringing you psychosexual conversations that will leave you intellectually turned on and hungry for more. Can psychedelics be used to help people taper off of antidepressants, or is that a good idea? Has the thought of that, or how does that?
Yeah. Well, that's the golden horseshoe question, isn't it?
I do get people who ask me that because they
I get people ask me that all the time.
Mhm.
And I wish I could say that I knew the answer, legitimately for sure, right? I will say that I think people, particularly taking serotonergic antidepressants like those SSRIs or SNRIs, I think a lot of what they experience as far as withdrawal probably is actually linked to lower serotonin levels, either because, they've been boosting it for some period of time, blocking the serotonin reuptake pump. Maybe they have less serotonin receptors as a response to having more serotonin around consistently. So if you're kind of thinking, well, psilocybin, LSD, those are serotonergic. They bind to serotonin receptors. Couldn't that help restore some of the missing serotonin signal and maybe sort of take the edge off some withdrawal symptoms? Plausible thought, waiting for the experiment to demonstrate it, right? So when people ask me this, can I use psychedelics to taper my antidepressants? My answer is sure, if you want to, because I don't really feel like, at least if you're talking about psilocybin or LSD, that there's a whole lot of risk of toxicity from combining them. But I always encourage people to think about it like, really, you're doing two separate things here. You're going to do a slow and careful taper of your antidepressant according to best practices, the same way that we would do it, whether you're going to use psychedelics or not, right?
Yeah.
And in that process, if you want to start some carefully monitored microdosing, if you want to see if you can get some benefit from an experience before you're completely off with like a macrodose type of situation, I'm generally okay with that. But you really should sort of view it as like, I'm doing two separate things. And like, if the microdosing and if the macrodose helps me with my taper, wonderful. But I'm not counseling people to expect it to help with their taper or telling them that it actually does, because I just don't know that for sure. And I have found people report like, man, that really did help. Or, man, I stepped off antidepressants 2 or 3 weeks later. Gosh, the brain zaps were killing me. I started microdosing and they just kind of cease and desisted. I've also had people that maybe they take a step down on their antidepressant and they're in some level of withdrawal, and then they pick a microdose that's a little bit too high, and then all of a sudden it seems like they're in this sort of inflated withdrawal state that is just very unpleasant for them, and they're sort of like, oh, that feels awful. Or antidepressant withdrawal could be characterized by a lot of anxiety, difficulty sleeping, things like that. And that's what I commonly get reported by people, probably when they're pushing their microdose, is they get anxiety or difficulty sleeping. So you're adding another cook to the kitchen, right? You're tapering your antidepressant, you're adding another cook to the kitchen. And it's kind of like, people don't do great monitoring on themselves in psychotropic medications normally. And now you're adding this like extra thing in there. So I just really feel like people need to be fairly scientific about it. They need to be taking pretty close notes. And if they're going to do that, right, I usually suggest that they start their antidepressant taper and go with it until they actually get to a point where they've been tracking withdrawal symptoms. And it seems like, okay, I have this set of withdrawal symptoms that seems fairly consistent. If I introduced a microdose, or if I took a larger dose, perhaps with like a facilitator, how does it actually impact those sorts of like things? Whereas like sometimes it's like, well, I wanted to taper my antidepressant, so I started microdosing. Like it's a prophylactic kind of tool. And it's kind of like, okay, well, if it's going fantastic, you won't know if the microdosing really did anything for you, or you could have done that without microdosing. And if it's not going fantastic, you won't know if you're really struggling with withdrawal or maybe just side effects to microdosing. So I like to people to do sort of like one step at a time, like at least start your taper and sort of get in a groove with that and see how things are going. And when you have some sort of specific things that you're hoping a microdose or a larger dose of a psychedelic could address, then the chances of being able to actually see that clearly seem to go up if you're to wait. And generally with microdosing too, I encourage people to take breaks every couple of months because I am worried about long-term risks of valvular heart disease with chronic or semi-chronic dosing. So if I'm sort of thinking, well, man, maybe the average person that hasn't been taking antidepressants very long at all, they're not sensitive to withdrawal, maybe 2 or 3 months is a pretty, standard time frame to try to stop the medication. But there's people that are pretty sensitive to withdrawal out there that might be looking at more like 4 to 8 month processes for tapering an antidepressant. And okay, if you start microdosing at the beginning and you have to stop it and give a break halfway, I don't know, like you want to have that ace up your sleeve, I think, as you get towards the end and things get more difficult, rather than kind of just doing it all at the beginning and hoping for a good outcome. Yeah.
Sure. And that's where we add in some of the holistic aspect of it too. Like what are some of these other tools that, whether down regulate our nervous system, or we're working with a therapist, or we're going into sunshine, or exercise things that do help to support
exactly.
that.
Like physical activity is probably one of the most helpful things for antidepressant withdrawal.
So ultimately,
easier said than done, right? If you're the person counseling and the other person's like, well, I mean, the reason I'm taking this is because I didn't really have that much motivation to begin with, and now I'm trying to stop it. And it's like, I don't really feel like doing much of anything right now.
Yeah.
So how am I supposed to? And I think that's the work. It's very hard. It's very hard. It's not easy. And
Well, that was fun. Thanks for tuning in, lovers. And if you want to experience more ecstasy and sexual liberation, head over to sexlovepsychedelics.com and learn about how you can join me for any one of my online or live events. And while you're there, grab my free guide on sex and psychedelics. Remember, this podcast is for entertainment and educational purposes only. Please contact your healthcare provider and local law before pursuing any of the products or psychedelics discussed. And one final note here. I make this show specifically for you. If you're loving the show, then be sure to leave me a review in iTunes or Spotify to let me know. Happy to be here and happy to serve. I'll see you next time on Sex Love Psychedelics.